Thank you for joining us today. My name is Bob Twasuden, registered nurse with the ALS Association. Our topic today is respiratory with ALS, and our guest speaker is Josephine Ariella Pelza, better known as Josie, and she's from Millennium Respiratory Services. Josie services both our clinics and sometimes in our community delivery of services for respiratory services through Millennium. She's an experienced respiratory therapist with a demonstrated history of working with ALS. She's been in the medical device industry for many years. She's skilled in advanced cardiac life support, critical care nursing, healthcare management, and respiratory therapy. Please welcome Josie today as she reviews with us respiratory equipment, as well as answers questions that may be pertinent to your use of respiratory equipment or future use. Josie, thank you for joining us.
Thank you. Hello, good morning. I'm Josie, and I'm going to speak about the experience you would have in the clinic, and I also have equipment here to demonstrate for you guys. So initially, it'll start once you start having the symptoms, and you go to see a neurologist, and as well as all the other disciplines. It is very important that we follow you guys with the respiratory component, because as you know, the ALS affects the muscles, and what we need to breathe is a muscle also. It's like an accordion. So it goes in and out, and once it gets weak, we may need a little bit of help. So when you got the experience you'll have when you go to the clinic, we look for the O2 saturation. We look for end-tidal CO2, your vital capacity, your cough flow, and your nib, which is to measure the strength of your diaphragm. So once the therapist says that, we share the information with the neurologist, and it's up to him to decide. He'll decide whether you need help or not. So once you do, it'll be one of these equipment. There's a ventilator, which helps you breathe at night. If you express difficulty breathing, especially when you're laying down, if you're short of breath, when you're doing minimal activities, then the ventilator will help you. You start using it basically at nighttime. Okay. So it has different types of interfaces, but we usually start with a non-invasive mask. It looks something like this. This would be like a fake full face mask. And there's others that we can use to accommodate that. And this is my partner, Rick. I'm sorry. This is Rick. He's my coworker, and he'll be jumping in every now and then too. And here is the suction pump. This is usually like if you're not able to expectorate. This has like a wand. Yeah. It has a wand, and it has a container here, and it contains the secretions, and this is what you use to sweep your mouth with. And here is the cough assist. The cough assist, it has two functions, and usually this is one of the first things you'll get. What it does, it's good for lung expansion and for airway clearance. So a lot of the times the doctor will prescribe this equipment, which you will feel is a little early. But sometimes we'd like it to have it a little early, so this way you can get acclimated with it, so that when the time really comes, you're not going crazy or running to the hospital while you already have the equipment that you need at home. So for example, the cough assist, it'll help you. Actually, it'll do the cough for you. It'll give you a blast of air, and you'll have like a suction component, and that's the actual cough. So if you're having a hard time coughing, this will do the job for you. And if you don't see any mucus or whatever, it's expanding your lungs. So it's like an exercise, and it's something that has to be used all the time. So I usually emphasize to my patients to please use the equipment daily. Once you get it, even if you think you don't need it. So this way, that's the only way you'll get used to it. And the key to getting acclimated is being consistent. Okay. So the orifices can be used in 3 different ways. Sometimes we start out, with a mouthpiece. Some people have a mouthpiece because their mouth is still strong enough to seal their lips around it and are able to take the blast of air from here. Okay. So once you're not strong enough, we have a face mask. And this will cover the nose down to the chin. And a lot of people are comfortable with it, and it'll do the same job. It's also used with patients with trachs. And it has the same, and the therapist will give you the settings necessary, and we will change it according to your comfort. Some people can start right off with a high pressure, and some cannot. Will have to work themselves to it. But the idea is to get you guys comfortable and acclimated with the equipment that you need. Okay. So let's say you learn to use the orifices, and that means bringing up secretions, and you can't expectorate. So this is where the suction pump comes in. Sometimes it'll come up, and like I said, you can bring it out. So this will sweep it out of your mouth and take whatever mucus secretion is there. So usually they both work hand in hand. So the ventilator, this will help you with your breathing, as I said earlier. And Rick can speak a little more about it.
Yeah, basically, this is one of the models that are popular out there. And this is referred to frequently as NIV for non-invasive ventilation. There are a lot of clinics that start with a machine called, I'm sure you've heard the term BiPAP. They'll work, to a limited capacity up to a certain point, and then if the patients, do start to develop additional breathing issues, we can do much more with a non-invasive ventilator. Clinically, we've had much more control over it. The breathing can be much more passive as far as exhalation, so it's more natural breathing, and we can basically guarantee that every breath is a quality breath.
Yeah.
Okay, not everyone that has one of these machines doesn't mean you're automatically on oxygen. Typically, our patient population here, we typically don't use oxygen much. It may even be contraindicated. So all you need is good, fancy, deep breaths. That's why some people, it's nothing but a fancy blower. Okay, and the amount of interfaces, as we call them, as Josie touched on, there's so many on the market, it's difficult to keep up with. They are pretty much the same type as they would use for sleep labs, except we'll customize them just a little bit to be able to take the pressures that we're delivering with this equipment. And it's much more effective at lowering the carbon dioxide levels and maintaining the oxygen saturation levels. And as Josie had mentioned, some of them just fit right in the nose, like almost like a larger version of nasal cannula. Okay, there's some that just fit outside the nose. And then this particular one, for people that may be mouth breathers, and there's a lot of us out there, this will cover the nose and the mouth, and some people may prefer to sleep with this one. And then if they need additional breathing during the day, they may just go even with a mouthpiece on this. So there are a lot more options. These machines also have battery backups. They have alarms if are necessary, if they're required, that will let people know that if something isn't right with the machine or the connection or something. So there are a lot of variables involved with this, but this is basically what will keep them out of trouble breathing wise. And real quick with the cough assist, and I do a lot of neuro clinics myself. I always call it the pneumonia preventer, because basically that's what it will do. Most of our patients do not get pneumonia if they're using that machine as directed.
Correct.
And it's literally an artificial cough machine. That's literally what it is. And then as Josie mentioned also with the mouth, with suction, this is basically just like a dental tool, like a dentist's office. So you just kind of go back and forth in the mouth. You dip it and it flushes itself out. And so it's more of a comfort device even at this point.
Any questions? Okay, so some of the symptoms that you may be presenting, it's always important to talk to the doctors. If you have morning headaches, it's a headache in the morning when you wake up, and it'll probably go away maybe like 15 minutes, and you think everything is okay, but you're feeling it almost every day. That can be an indication that your CO2 is elevated, and you need help bringing it down a little bit. So if you use the ventilator while you're sleeping, when you wake up in the morning, you'll feel a little more rested, you feel with a little more strength, and you won't have any more headaches. So that's one of the indications. Besides the fact that if you're having issues when you lay back, let's say if you use one pillow and you feel like you really can't catch your breath, that's another indication. And always make sure when you go to the clinic, you let the doctor know or the respiratory therapist, because those are things we look for.
We tend to ask a lot of repetitive questions every time you come in. The headaches is a main thing, and usually a lot of times it can be confused with the sinus headache because they're right here. And basically, we know it's a respiratory headache if you take some deep breaths and it tends to go away. Also, we ask that there's 45 breathing muscles, and the diaphragm does the bulk of the work. So as the diaphragm starts to weaken, there's additional use of what we call accessory muscles. And that's something that we'll visually catch when they come into the room, which could involve shoulders lifting, neck muscles tightening. So we'll also ask you when you lay down, is it difficult to breathe when you lay down? Do you need numerous pillows? Do you have a recliner or a hospital bed that is easier if you lift up? Those are all signs that are important for us to know. Do you get short of breath just sitting passively watching TV? Perhaps the most common is upon exertion, and it could be something as easy as brushing your hair. When you're speaking, you get short of breath when you have to talk a lot. There's a lot of little things that we'll ask, we'll look for. The swallowing, that you feel like there's often thick secretions that are coating the throat that you can't clear. Are you constantly doing that? That's why we started to call this early.
Josie, one of the questions came up, is there one machine that covers all these types of uses?
Yes, there is. That's the Voxen, and it has 5 components, and it does cover everything. It has the cough assist, it has suction, it has nebulizer. You can nebulize your treatments with it. And it's a ventilator as well. And it also has oxygen, but as Rick said earlier, our ALS population really don't use oxygen, so we'll just leave that aside. But yes, there is a machine that has everything.
Okay, and another question basically, is there battery backup if I take a long trip and need portability for electricity?
Yes, there are batteries. I think the first one is what, 6 hours?
Yeah, well, I think he's asking in general for the equipment. Basically, everything you look at that we have has battery backup.
It has batteries.
This has about 8 hours by itself. You can add additional batteries to it. There's portable suction. Nothing here is plugged in, and it has its own rechargeable battery. The cough assist machines also, we carry the 2 different types, and there is a lithium battery that's available for that as well. So you can definitely travel. The equipment is aircraft rated for safety. FAA approved, so you can travel globally.
Right.
If you live in a place that you have frequent power outages, you're going to be covered for most of the day, if not all the day.
And some of them have charges for the car also, if
Right.
you'll be driving for a long time.
So you definitely can maintain your active lifestyle to the best of your ability, and then safety backup as well. We know that there's a lot to take in, and a lot of questions that typically come up more along when you actually start using it. It's hard to ask a question we're not really sure, if and when you may even need some of this equipment, or which type you do wind up with, because we do carry that machine that Josie mentioned.
Right.
We just didn't fill up the whole table, but we have quite a variety of different equipment that we try to suit the patients and families' needs as well, to make it easier for the caregivers as well. Also, typically, as far as home follow-up, you should be getting at least a monthly visit from a respiratory therapist to come to the home. It's not just to check the machine mechanically, but
It's just to educate the patient, to re-educate as long as you need it. And if there are the family members who probably were not there at the time of setup, we can educate them too, so they can know what to do to help you with the machines as well.
yeah, the home care companies should have a 24-hour on-call service for that questions that you call.
And how often would a respiratory therapist usually come into the home for servicing, for general servicing?
A week. If there's a ventilator in the home, we come once a month. However, we're always on call. They can call if there's something going on. Outside of the working hours, outside of 9 to 5, there's always a respiratory therapist on call. And we'll either try to troubleshoot over the phone, and if it's absolutely necessary, we'll try to make it there the following day and see what the problem is. But we do make the visits once a month. For the cough assist alone, it's less, but we're always calling. We're always calling just to make sure you're doing okay.
And it's not to say that if there is an additional concern that you can't call us or request numbers that we will be there.
Right.
You know, there are times when we're at the same house 3 times in a week, you know, for going over a little tough stuff. So,
Because this is something new when you get it. So we expect frequent calls, especially at the beginning.
Right. And if I have multiple machines, can I have my therapy company exchange them out for the combined one with multiple functions?
you can, but there are pros and cons to every choice that you make as far as equipment. You can definitely choose a ventilator like the Voxen, which comes in different levels. There's a Voxen 5, which does all 5 modalities. There's other ones that can only do just ventilator and cough assist. You know, there's different combinations of it. The things that you have to realize is sometimes, you know, it's okay if you're relatively not very active, if you're in one room most of the time. The machine is bigger than these machines. It's relatively heavy. Can it be portable? Yes, it can. But some families prefer to have the separate components because they'll perhaps take the cough assist machine and they'll bring it from the bedroom down to the living room and back and forth. And those other machines, just actually life support equipment is more difficult to do that with. So there are quite a few options that you can do. Whatever the patient and the family is requesting, will do the best to meet their needs safely.
And can you talk a little bit about, will insurance companies cover these equipments differently, or are they consistently covered?
Well, we don't really touch on insurance because everybody's.
Yeah, we're in the clinical
everybody's
aspect, so
different.
you know it would be inappropriate for us to speak about insurance.
Yeah.
But with Medicare, the equipment is covered. It's basically, you know, there is a certain amount of supplies and equipment that are approved by Medicare to be given monthly and sometimes every 3 months. But these are things that would be discussed with
Individually.
Right.
Right. And another question coming up is, how often do you clean the equipment, or what's the process for cleaning?
Cleaning is taught in the home. Family and caregivers are responsible for the cleaning of the equipment. We will train and support it, but the family, there has to be someone in the home that's capable of changing filters and things like that. You know, supplies are sent, but they're expected to know they have to have someone to help them clean it, because it's not like a hospital where you have a respiratory therapist can go and run over there and clean the equipment for them.
So this is probably emphasizing the education, so that to make sure you guys are constantly being educated and know what to do in the home.
Very good. And if you're having services and you're using the equipment, but you seem not to be getting the same good effect that you used to, is it good to call your respiratory therapist, or should you be in touch with your clinic?
Call the respiratory therapist. We know you better than anybody because we're the ones who've been in your home, and we know that exactly the
and we'll try to make it to you as soon as possible.
Yeah, the whole scenario. And the clinic is going to default to us anyway, to be honest with you.
Right.
Even the pulmonologist will say, let's call Josie, you know, or Rick, and have them follow up and advise us on what's going on.
Right. And if I'm having a little more of a Labor Day, I'm going to have company come. I may have to be a little more strenuous. Is it advised to use the respiratory equipment prior to their visiting so that I may have a better result and a better interaction with family?
Yes, I usually advise my patients to do that. For example, if they are going to have, let's say like they go into the clinic, I usually tell them, if this patient is able to do without the ventilator, or if they're not 24-hour dependent, they can use the ventilator earlier, or just wait when you're just about to leave the house and then you take it off and then do your visit, whatever it has to do. And then when you come home, you go right back on it and get some rest. Because a lot of the times I understand people are fatigued after certain activities. And if you need the ventilator before then, some are able to take it with them to wherever they have to go. And it can always be nearby. So if they really need it at that moment, they can put it on.
The physicians that trained us many times will refer to it as you recharge your battery. So you kind of
Yeah.
get yourself some good quality, ventilation for a little while. You're a little more energized. You can spend a little more quality time. I often advise my patients to use the ventilator for a little while in the afternoon, an hour and a half while they're watching TV, just to re-energize a little bit so they have more energy to spend quality time at dinner with the family. In the old days, I was a lifeguard in the old days, and what we do before you swim the deep end, you take deep breaths. So I said, take some deep breaths first, and you have more energy to keep going.
Yeah.
So there's a lot of little tricks that over the years that we definitely will share.
And say I'm traveling on a plane or on a longer trip, are there indications that I should notify the airline of special considerations or needs?
Yes, we recommend that you do. When you reserve the flight, you have to let them know that there is a ventilator. You'll be taking a ventilator with you. And it's FFA approved. So as long as you let them know, there shouldn't be a problem.
And if I'm working with an ALS clinic or pulmonologist, how do they work together? What synergy is going on? What do they need from each other in order to get my best result?
Well, the therapist, we do the assessments in the clinic and we give that to the neurologist. And he will let us know, okay, we'll talk amongst each other and he'll let us know if this person needs help with equipment and he will write the prescription. The prescription will go to the company who provides the equipment. Then we will contact you, the patient, and we'll set up a schedule to come and set it up, to teach you, and we'll go from there. Once you're under our care, we're always there to provide.
And also, if during the clinic there is something that, as respiratory therapists, we'll find something that maybe has more pulmonary component, then we'll advise them of that, and then they will speak with pulmonary. And if there's something more going on, or you could have ALS but also have emphysema. Before that, you could have another chronic issue with pulmonary that will make the case a little bit more complicated. So there is often pulmonary speaking with neurology and us as well.
And if I was going to the hospital or have a home care vendor coming in or even a hospice vendor, and they're telling me I should be on oxygen, how should I reply or how should I direct them about my current respiratory needs if I'm on non-invasive respiratory equipment already?
Well, basically, we tell them that you almost have to present yourself as a CO2 retainer. Basically, what that means, that applies more as a term more for emphysema, but it will apply to neuromuscular as well, where you have a tendency to retain carbon dioxide. If you give a patient with elevated carbon dioxide additional oxygen, it'll actually spike the CO2 levels. So they cannot be placed on high flow oxygen. Hospital policy, pretty much anywhere in the US, they're going to automatically put you on O2. We tell them, this is part of the education we give, that perhaps nasal cannula at 2 liters, not a full mask. Yeah. If they are in need of additional oxygen for cardiac issues or pulmonary issues, it has to be delivered through a breathing device from the hospital. You can't just give it by itself. So it's not something that you want to give automatically, especially to an ALS patient. But this is all part of education. And that they should, at that point, whoever is seeing them, then contact the ALS clinic. And then they can speak perhaps to the neurologist or someone there if they want to hear it from someone within the clinic. That might be the path I would recommend.
And I have a power wheelchair. How do I accommodate my respiratory equipment or ventilator equipment for humidity when having those type of integrated uses?
For you.
Well, I mean, you talk about like humidity outside, are you saying?
Right.
For the patient.
No, I think he's talking about outside.
Oh, sorry.
Yeah, all of these machines are designed to be indoor, outdoor use, and they do go into an additional travel case that's covered. So it's the machines nowadays that weigh 7 to 8 pounds compared to the older ones, who were about 28, 30. The boxing obviously is a bit bigger, it's like 24, I think.
Yeah, and we try to put it like in the back of the chair.
Yeah,
And if we have to jimmy rig it, if somehow we find a way.
yeah. But we have patients that go on the boardwalk with it, in the salt
Mhm.
air. We have patients that got caught in the rain that were at a concert. The machine keeps going. It's designed to take it.
Quite durable.
Yeah.
Will my respiratory therapist advise if I should have travel equipment versus having just stationary equipment?
You're going, you will get travel equipment regardless.
Mhm.
Pretty much everything in home care is considered travel. There's a few, perhaps there may be an electric stationary suction machine, which is electric only, but you would still
You'll
get.
have a portable, which is this one, that you
Right.
can take wherever you go. And basically the ventilators also portable. So
The cough assist as well. There's basically nothing in DME
everything is portable.
for the home that's not considered portable.
Right.
Anything can travel, let's put it that way.
Are there any other devices or machines that you're going to cover during this session?
No, these are the basic ones. And this is what we use, yeah.
Yeah, these are the most common. There are
Yeah.
other ones, but it'd be a little too lengthy to go into those. This is
Yeah,
by far,
these
these are the most
basics,
common.
yeah.
Yeah, the most helpful.
And for cleaning equipment, I know we talked about the family or a caregiver would be responsible for the cleaning regime. How do I get, or is there new tubing or other accessories that come on a service interval, and what should I expect?
Yes, you will get supply at the beginning of the setup. You will get like 2 sets of supplies. You'll set up one, and you will have more supplies. That's for extra. We'd like you to have an extra tubing and supplies in case something happens in the middle of the night, whatever. So you have something to replace it. And also, when we do our visits, we usually ask if you have enough supplies. You want to make sure you have enough supplies. And also, we'll teach whoever's taking the caregiver how to order supplies. They can order supplies monthly. They should be changed monthly. But we'll teach you how to order. And we provide it for.
And are the portable equipment, they also have humidification with them, just like my standard equipment?
Yes, we do. The ventilator, we have two kinds of humidification. There's one that's stationary, stays in the house. That's the one that has the water inside, and that stays home. And also we have an HME that goes within the tubing, and it's dry, it's not wet, but it humidifies you as you're breathing the same moisture from your breath, and then that's what provides the humidification. But it's inside in the tubing, goes within the tubing.
And on the orifices, the indications for that type of use, and how often should I maximally use it in a day?
It's recommended to use it twice a day or 3 times a day. However, if you really like, let's say if you have a cold and you get sick, you're sicker, you can use it much often than the twice a day. Twice a day is basically like therapies and exercise. Okay. So you have to use it. Don't just. I always advise not to put it away. Use it every day, and that this is the only way you'll get used to it as well. So we'll come in and put in the settings. Some people will catch on quickly. Some will not be able to tolerate the pressure. So we'll make it comfortable for you, but as time goes on, we'll increase it until you are where you're supposed to.
And if I was on the non-invasive and it doesn't work as effectively as more often, would I possibly need to go to an invasive equipment, and what would that be?
Well, then if you're talking at that point, then the choice has to be made, whether it's clinical reasons or family reasons to choose to go with the tracheostomy. Then that would be the invasive part. All the same equipment that we carry can do both. So if somebody was to get to a point where they have to make that decision, or perhaps the decision has been made for them, clinically, then it'd be the same equipment. We would just obviously have to setting changes and perhaps different supplies to maintain the LA.
And I guess a question came up about cough assist again. I think you kind of covered it, and maybe they didn't hear it originally. It was, should I use cough assist in the morning and at night? And do I need to use it twice a day? But you're recommending anywhere from 2 to 3 times a day. Is that before meals typically?
Yes, we prefer it to be before meals, or you can wait like 30 minutes after a meal to use the cough assist.
And over the years, I've always recommended that definitely is part of your morning routine, because all of us, when we wake up in the morning, we get up, we have to clear our throat with mucus. Even if we are standing in a hot shower, we clear our throat. So that's the most important time of the day. It's actually first thing when you get up. And many patients have told me over the years that they sleep better, especially if they're using a non-invasive machine for breathing, if they use it before going to bed, because it clears their throat out before they hit the machine as well. And like Josie was saying, if they use it 3 times a day, I'm thrilled. But the minimum of twice, and most important, without a doubt, is when they first get up in the morning, and comfort-wise in the evening before bed.
Will my, if I consistently use my equipment and I use it as recommended, might I come off the equipment down the road, or will this be a regimen that I'll have for a lifetime?
This is a treatment. Unfortunately, it's not a cure. We can and will keep you comfortable, but if you are diagnosed with this condition, it's a very rare that you will wind up not needing it after a while. If anything, you'll actually look forward to using it more because it'll feel better.
Right.
And how often will I be assessed on my respiratory status on a general basis if I'm pretty much status quo?
You're assessed every time you go to the clinic. I think most clinics are like every 3 months.
3 months, and not to mention when the respiratory therapist comes to the home.
Yes.
Yeah. And if the RT in the home notices that there's something, many times they'll pick up the phone and make a phone call to their doctor or clinic for them and tell them what's going on and get some recommendations. And many times they'll see a prescription for antibiotics or something like that.
Right.
Decongestant, over the counter recommendation. So that's a good thing about if you are indeed getting a monthly visit.
And we communicate closely with the neurologist. So yeah.
A question came up. It was kind of not for our session, but just said I missed the previous session. Can I view it? And yes, these sessions, including this one, are being recorded, and there will be a link available through the chapter on YouTube that will allow you to review a session that you attended or watch a session that you missed. So for that person asking that question, we will have those made available shortly after all these have concluded. Any closing recommendations that you feel that patients would best recognize? Should they freely call on you when they have a question? Should they wait for their next general servicing? Are there the importance of keeping equipment clean?
Yeah, well, firstly, please pick up the phone and call us. Many times we are the first line that they'll pick up, because as I said, we're the ones actually seeing them in the home and know what's
Right,
going on.
and we usually have good rapport with our patients.
Right.
So they're free to call whenever.
Yes, yeah, please don't hesitate. Don't ever wait for an appointment. If something's going on, when you call us.
Absolutely.
Many times I'll shoot out to the patient home even before the clinic, and so I can have additional information for the neurologist or pulmonologist, or even cardiologist, depending on the clinic. And as far as equipment, and cleanliness, it seems to be coming up a lot. The majority of the equipment nowadays, the supplies are disposable. It's not like the old days where we got to wash them. Most of them, once a month, you actually toss them, from the bacteria filter to the tubing and things like that. Obviously, if the patient happens to be trach, then it's a totally different story. There's all different clinical reasons that we have to, keep that clean. But these are things that are constantly, any filters and things like that are reviewed with your monthly visit.
Yeah, and then usually we'll show you how to clean the interface, which is really the direct contact to your face. And you're entitled to one of them every 3 months. So it's important to keep it clean.
And that's a Medicare allotment. That's not ours.
Not us.
Yeah.
So the interfaces for the ventilator needs to be washed, the mask offices as well. And it can be easily washed with a little bit of dishwashing liquid and water, and you just let it air dry, and it should be ready for the next use.
I frequently see television commercials about implantable devices for respiratory issues. Are they relatable to ALS, or
No,
not at all.
no.
being discussed today?
No, I'm sorry, but they're not at all. They wouldn't be of any help for this population.
I'm just going to check questions again. We'll see. I think it additionally came into our Q&A area. And I guess it often comes up that in the hospital, when hospitalized, patients find that the staff at hospitals don't often know about the different force pressured equipment, as well as possibly even cough assist. Is there a best simple way to explain to those staff the need for respiratory equipment, or should we put them in touch with the vendors supplying us equipment?
That's a good question, because every hospital is different. There are hospitals that will allow our patients to actually bring all their equipment in and be used there. Unfortunately, the percentage isn't nearly as high as we would like. So that this is a lot of times they'll be treated more as if they're sleep apnea or pulmonary related. And so that's why I have to stress how important family support is and people that speak up for themselves. And tell them to reach out to the doctors at the clinic. It's really important to have them be in touch with neurologists or pulmonologists involved in their care. We're always more than happy to speak to the doctors, but we're more on the side of the technical questions and answers, equipment related, clinical issues in the home. But as far as the therapies that are being given in the hospital, that can be.
They all have their own policy.
Yeah, that can be difficult. So that's why we stress over and over again how important it is for us to educate the family and caregivers and the patients themselves that can speak for themselves, because you do have to stay on top of everything.
And a new question came on. Can I stay on my BiPAP equipment versus being trached? What would be those indications?
Let me handle this. Yeah, a BiPAP, once again, is something that it's a pressure machine, so it's limited as far as what it can do and help. It's also not, don't have battery backups and things of that nature. So there are people that can stay on it for quite a long time. Other ones, if the lungs, with all neuromuscular conditions, the lungs tend to get stiff. So pressure machines are limited as to the lung expansion. That's why we use non-invasive ventilators, because they have more much more ability to ventilate, you know, as a clinician. As far as with the trach, really, the bottom line is, which is surprising, is not so much the ability to breathe with regarding the trach. Really, the red line with the trach is if you start to get aspiration pneumonia from your own saliva and you can't handle secretions through your throat, then you have no choice but to get a trach. Not everyone gets to that point, though. Everybody's different. You know, there are clinics and certain doctors that tend to trach sooner. You know, we do see that frequently. But if your pulmonary issues are plateauing and you've been pretty stable for a long time, we don't like to rock the boat. As long as your numbers are still okay when you come into the clinics and we see you in the clinics and you're maintaining, we're thrilled, just, you know, almost as much as you are. But like I said, if you're avoiding pneumonias and your pulmonary status is stable, you only have to go on to a trach if other things were to develop down the road.
Very good. Looks like we've addressed all the individual questions that have come through. Some have been a little redundant in asking. Are there any recap on the types of equipment and the suggestions for equipment that we'd like to do as we wind down our session?
Well, once you get the equipment, like I said, you have to become compliant. And the only way you do that is by consistency. And with our help, it usually works easier for you guys, because we are there for you. Anytime you need, you know, you forget something, we're there either by phone, or we usually go as soon as we can to re-educate. We have to go over the whole thing again, we do that, because our goal is for you to be compliant and be comfortable with the equipment. Like, equipment is equipment, so you have to do the work and try to use it consistently.
And if when you're issued equipment, is it normal issuance to get a pulse ox along with your equipment?
With the high-level critical care setting, which is predominantly with trach, you automatically get a pulse oximeter. You know, that's our, I'm sorry. Yeah, with typically with a trach or like I said, you know, one that's maybe a little, we have to really keep an eye on. That's our company policy. It's not necessarily written. We'll choose to do that. The good thing is nowadays you can go to the local Walgreens and CVS and buy a small pulse oximeter for $39.99, and the digitals, and that'll give you spot checks that you do yourself. You know, so that's the best thing that's come out in the last 20 years.
And what would be the best, say, values that say that I'm in a good zone versus when should I be in touch with my doc or yourself if my values are dropping below?
It should be between 95 and 100. But yet there are some people who are doing just fine with 93 or 92. Now, if it gets to 90, you have to call your doctor. You know, we have to start looking to see what's going on.
And just a little trick, which is really important that we always stress, is a lot of times your readings will be a little bit lower because you're kind of congested. Basically, you may be fighting off a cold. So use the cough assist machine and you'd be surprised. You clear the airways, it'll jump right up to 97, 98 again. Then you know you're not in trouble. If the things that you have been taught that you are trying are not what we call reactive, and your O2 sats are staying around 90, 88, call the doctor. You know, if they are a little bit low and you're able to get them back up, even with deep breaths, you're not in trouble, you're okay. So it gives you a little peace of mind as well.
And if for some reason it's a weekend and I'm not getting a response from my doctor or my clinic, or my numbers are appearing to fall, but I've used the cough assist and the machines as best I could, is there an indicator that I should call 911?
Most of the times, That would be the case, but we would go over, well, you would probably call us.
I would hope you would call us as well.
Yeah, and then we'll try to help out with what we can. over
We
the
can
phone.
help troubleshoot, give you some clinical guidelines over the phone as
And
well.
if still it's not working, then maybe something else is going on and you need to see the doctor. And then we would ask you to call in.
Very good. And are your services available 24/7? Is there any live operator that if I have trouble at 3 a.m. in the morning and have doubts about my equipment use, and is there someone to call, or is there a time limit for calling for support?
Yes. After 5 o'clock, we have an on-call service, and there's a respiratory therapist on duty 24 hours. So like Rick said, we'll troubleshoot. We'll try to troubleshoot over the phone, whatever the problem may be, especially if it's equipment. And if we feel that it's something else, we will recommend that you see the doctor, depending on what it is. If it's really an emergency, you can't breathe, and you also have to, we might tell you call 911. Or maybe the next day, you may be able to call your doctor and go visit them.
And if it's something depending on a piece of equipment that's obviously equipment related, then we can get out there in a few hours and we'll send somebody out to actually change it out. If it's obviously mechanical, but they're out of backup. So yeah, the bottom line is, yes, there is an answering service. You'll speak to the operator. You'll state the issue. She'll contact. The respiratory therapists are by region. So we have respiratory therapists specific to certain areas, so they'll be familiar with the geography and the patients. And then that's who you will speak. There's a few of us that rotate, so you can get a number of us, but we all do the same thing, so we all be familiar with this situation.
Do most patients get issued a cough assist, and or is that something that's considered for different indications?
The cough assist is for airway clearance. That's the most important part. But as Josie said, it's probably one of the few things that we could recommend as almost as physical therapy, because one of the things that we do is called lung recruitment strategies, which basically is opening up the airways, because the lungs will tend to, as I said earlier, they will tighten up and they'll close up a little bit on you. So the cough assist, by giving that deep breath first, it helps to open up the lungs. It feels really good. And then when it goes into the negative pressure mode, which helps to clear the airways out. So that's why we frequently will start with the first machine being issued, usually is a cough assist machine. It'll keep them out of trouble, and we'll get them used to accepting the idea that having a machine to help them do something may not be that bad of an idea, and they'll actually be grateful once they have it.
And check questions for anything additional coming through. Okay. Seems like most questions have been answered, if not in just phrased slightly different. I'm just going to check one last place for chat. I think we've covered all questions that have come through our group. I want to thank our presenters today for giving such good clarity and usage of the different machines and their availability to service or be on call. It is most definitely a big feature that Millennium is very responsive. You should always check also who is your equipment issued by. Usually there's a tag on it with an 800 number. So be familiar with what that is and know who your service rep is, and definitely use them. They're there for a resource and wonderful with information as well as servicing. I want to thank everybody for joining us today with this session. Many questions have been answered. I hope yours was too. If we are having at 12:30 another session that will be about living safely in an accessible home. There's no place like that. And I hope you join us at 12:30. And we thank you for joining us today. And as I said earlier, these sessions are being recorded and will be shortly available after the conclusion of the summit through a YouTube link. And that could be either accessed through your contact RN social worker at the chapter. There will be some general information distributed afterwards. And thank you for joining us today. Our pleasure joining with you.
Thank you.
Thank you.